Hello everyone, thank you for joining us today. My name is Dr. January Lopez. I'm a radiologist, breast radiologist here at Hoag Hospital, and I'm the Director of Breast Imaging here at Hoag. So welcome to our Hoag Healing Survivors breast cancer event. This is part of our Hoag Healing Empowerment Series, and today I'm going to be talking about breast cancer myths and misconceptions. And my partner, Leanne, here is going to be talking about healthful eating and body and mind. So for those of you who aren't familiar with our Hoag Healing Breast Cancer Survivorship Program, it's led by one of our amazing breast surgical oncologists, Dr. Sadia Khan. And Dr. Khan leads the group. This is a group at Hoag that is specifically focused at women and men who are survivors of breast cancer. So either going through treatment, after diagnosis, have been treated, perhaps patients who have metastatic disease and are have ongoing treatment. This is the group that's focused for you, your needs, educating, providing support, and providing resources. So welcome to our event. We're really excited to be talking to you today. So I'm going to be, again, talking about breast cancer myths and misconceptions. And I've been at Hoag for now 11 years. A lot of different discussions I have with my patients, but some of these are the top myths and misconceptions that I discuss with patients in my practice every day. The first one is nobody in my family has had breast cancer, so I won't get breast cancer. Very, very common discussion. I probably have this discussion 5 times a day. And maybe I've had this discussion with some of you. Even medical professionals, sometimes physicians who aren't specialists in breast cancer, sometimes have this misconception as well. So if we go talk about breast cancer risk, we know that 1 out of 8 women will develop breast cancer in their lifetime. And if you just kind of stop and think about that 1 out of 8 number, think of how many women that you know, that risk, we're already starting out with a very high risk just knowing that we are women. For those of you who are women, and there is breast cancer risk for men as well. Now, the part that is shocking to a lot of people is that actually around 85% of the women that I diagnose with breast cancer actually have no family history or significant family history or other risk factors. They would be considered average risk women when we look at all the women who are diagnosed. Of course, people who do have risk factors like a significant family history or a number of other things that I'm going to talk about have an even higher risk than 1 in 8. So the bottom line is for us to not keep our guard down. This is why we do screening mammograms in all women, not just in women who are of a screening age, not just women who have a family history, because we are all at risk. The other thing is that breast cancer risk really is multifactorial. People focus a lot on family history, but it's not just family history. There are a number of factors that can contribute to a person's breast cancer risk. So some of these, again, we discussed being a woman, that's number 1 risk for breast cancer. Also, as we age, our risk of breast cancer actually goes up. And sometimes you'll hear kind of confusing numbers when we talk about breast cancer risk. A lot of times we'll talk about lifetime breast cancer risk. And actually, lifetime breast cancer risk, and if you think about it, it makes sense. The lifetime breast cancer risk tends to be greater when you are younger because you have more lifetime ahead of you. But if you think about today, am I likely to develop breast cancer? That risk actually goes up as we age. You become a higher risk for developing breast cancer. Family history and genetics, that's pretty common sense and straightforward. I think most people know that if you have a lot of family members who have had breast cancer, that increases your breast cancer risk. Other things like radiation to the chest, which sometimes can be a little confusing as well for people who have had treatment for breast cancer and had radiation therapy. This breast cancer risk for radiation is actually referring to a different type of radiation risk in people who have had radiation to the chest at a young age. For example, people who have had lymphoma or chest wall tumors and had radiation. So that's relatively rare. And then race plays a factor where actually, Caucasian women are at higher risk for developing breast cancer, but across all ethnicities, the risk for breast cancer, again, is still relatively high. Obesity plays a factor, whether or not you've been pregnant and at what age you have become pregnant, whether you have breastfed. Breastfeeding, we know, decreases breast cancer risk. And the age at which you developed menopause or started your menses, and that has to do with your exposure to hormones. That can affect your breast cancer risk, and having a longer period of exposure to estrogen, basically we know has an increased risk for breast cancer. Hormone replacement therapy, that's a really pretty controversial topic, and we know that hormone replacement therapy does have an association with breast cancer risk, but that is not to say that all hormone replacement therapy will cause breast cancer, and I kind of leave the specifics of that topic for discussion at a later time, or maybe with your gynecologist to talk about hormone replacement therapy. And then other things like alcohol use, dense breasts, and interestingly, night shift work. They found that women who work the night shift tend to have a higher risk of breast cancer. So that's about breast cancer risk. The next myth, top myth that I have is about dense breasts and mammograms. So dense breasts I talk about a lot with patients, and this idea about what having dense breasts means and whether mammograms are worth doing if you have dense breasts. So the answer to that question is mammograms, yes, are still worth doing. And there's a couple things that are important for people to understand about mammograms, to know what, how mammograms work and how dense breasts affect mammograms. So it's kind of like these pictures of the forest and seeing the trees in the forest. If there's a lot of fog, it's going to be really hard to see the trees through the forest. And you could think of dense breasts kind of like the fog. If on this slide here, you can see these are actually 3 different women who all have breast cancer. And this slide is kind of to illustrate how reading mammograms really is not straightforward. A lot of times people think reading a mammogram is black and white. You see it, if there's cancer there, you can find it. If not, if it's normal, then you don't have breast cancer. And unfortunately, that just isn't the case. The first picture you see that has a little yellow circle is a woman who has a really early, what we call a stage 0 breast cancer, or a very aggressive one. And within that yellow circle, you can see all these little tiny white dots. So those white dots are what we call calcifications, which are really common, and most of them aren't cancer, but these calcifications are cancer. And in this woman, she actually has a lot of white in her breast. She has a very dense breast. But regardless of that, it's very easy for me to see a cancer like this. It doesn't matter how dense your breast is. The other thing is these type of cancers that present with calcifications sometimes can be seen years before you can see it through any other method, like breast ultrasound or even breast MRI. So you wouldn't want to give up mammograms even if you have dense breasts, because we wouldn't want to lose the opportunity to see early cancers like this in women with dense breasts. The middle picture is a picture of a woman who doesn't have dense breasts. So you can see most of her breast is pretty dark. It's like a dark gray. And then you see a little white spot in the center of that circle, which is a small breast cancer, a very early stage 1 breast cancer that is really easy for me to see in this woman who doesn't have dense breasts. This type of cancer might be hard for me to see, or maybe impossible for me to see in a woman who has dense breasts, this particular type of breast cancer. And then the third picture is a mammogram in a woman who has a breast cancer, but you can't see it. It's hidden in her dense breast tissue, and no matter how hard you look, you're not going to see that on her mammogram. Her mammogram is normal. So if we go to the next slide is a similar type of patient who has a very dense breast, and there's a cancer that is invisible on her mammogram. And I show this case just to kind of briefly touch upon some of our other ways of seeing breast cancer that can help us. So the next slide is the same woman who had the normal mammogram, and the dark spot in the center, this is an ultrasound. So this is a picture of a breast ultrasound in a woman with dense breasts, and the dark area in the center of the picture is that woman's tumor that we saw with the breast ultrasound. And then when we go to the next slide, this is a totally different type of test called a breast MRI, which actually looks at blood flow pattern in the breast. So this works in a completely different way than mammograms and ultrasound. And this is the same woman, and you can see the little colored ball, and the white spot in the second picture is that same tumor that we can see with the MRI. So this happens to be one of those cases in which mammograms couldn't find the breast cancer in a woman with a dense breast. But I'm going to show you another case here of a woman, again, with a very dense breast, lots of dense breast tissue. But again, you see those little white dots, those calcifications. And this woman actually has a rather extensive breast cancer. You see those white dots on the right-hand side of the screen in that breast. And you can see those white dots are covering a rather large area of the breast. And this is an early stage of breast cancer. This is what we call DCIS, but it's already become very extensive. And this is a cancer that we couldn't see on this woman's ultrasound at all. It was totally invisible on ultrasound. So dense breasts are important for mammograms, but mammograms are still really important in women who have dense breasts, because as you can see, we have the ability to see breast cancers that we couldn't see any other way. And we don't want to wait until this breast cancer becomes detectable clinically, where it becomes a lump that this woman could feel. She didn't know she had this cancer until she had her screening mammogram. All right, myth number 3. So myth and misconception number 3 is that the radiation exposure from a yearly mammogram is likely to cause cancer. So there is some truth to the fact that radiation can cause cancers like breast cancer. However, is it likely to cause cancer? No. Having mammograms and having the exposure from a mammogram is very, very unlikely to cause breast cancer. So how likely is it? If you look to the next screen, you'll see an airplane and you'll see some mountains. And this is a reminder for me to kind of remind me to give you some perspective on the amount of radiation you get from a mammogram. If you hopped on a plane right now and you took a transatlantic flight, if you flew to Europe, I know no one's going to do that right now because of the COVID pandemic unless you really needed to go there, but if you flew to Europe right now, you'd get the same amount of radiation you would get from a mammogram from the cosmic rays from the sun, okay? That's real radiation. If you fly to Europe, you are risking the radiation exposure, but it's a really small amount, and I think most people wouldn't think twice about jumping on a plane and flying to Europe because of the radiation. Also living at a high altitude. So if you lived in Denver, Colorado, and you spent 2 weeks there, you'd actually get the same amount of radiation from living in Denver, or just really being on the earth, being alive on the earth for a year. You get the same amount of radiation from the radon from the ground that you would from getting a mammogram. So the radiation is real. You do get radiation, but the risk is very low. So if we kind of think about it in context, and I think this is the most, I know some women are really kind of scared about getting mammograms and really think about the radiation. And again, the radiation's real. I'm not going to pretend like it doesn't exist. It exists. But if you kind of put things into context, again, our lifetime risk of developing breast cancer is 1 in 8. Okay, that's if you have no risk factors, if you're just an average woman with no risk factors. The lifetime risk of breast cancer due to mammogram, so just developing a breast cancer because having a mammogram is about 1 in 10,000, right? But that doesn't mean you're going to die from that breast cancer. In fact, if you're getting the mammograms, you're unlikely to die from breast cancer, even if the cancer, 1 in 10,000 chance it caused your cancer. The risk of dying from a breast cancer that is caused by a routine mammogram is about 1 in 100,000. 1 in 100,000. So there is a risk. There is a risk you might die from breast cancer that is caused by a mammogram, but the risk is very, very low, 1 in 100,000. And we know that mammograms do great things, like allow me to detect your breast cancer as early as possible. And we know that early detection of breast cancer reduces your risk of dying from breast cancer. And I guarantee you that risk is going to be the decrease in risk is going to be far more than your risk of dying from breast cancer caused by a mammogram. All right, moving on. The next myth and misconception is about 3D tomosynthesis mammograms. And some of you may or may not know about 3D tomosynthesis mammograms. 3D tomosynthesis mammograms are kind of the newest technology we have in mammograms. And what I call regular mammograms or 2D mammograms. Regular mammograms you can think of as just basically a one picture of the breast where everything in the breast is overlapping on itself. It's one picture. 3D tomosynthesis is where we acquire a mammogram at different angles, and each of these mammograms are very low dose. So the amount of radiation you get from a tomosynthesis 3D mammogram is about the same as you would get from a regular what I call a 2D mammogram. At least if you have it at some place like Hoag, where we create synthetic mammograms. It's true some other places where you might go, you might actually get double the radiation, but here you would get the same amount of radiation. So by getting mammograms at different angles, the computer software can reconstruct a series of slices through the breast at 1 millimeter, and that will allow us to see through the breast better and see through different areas through the breast tissue. Not only does this allow us to detect breast cancer better, so we can see cancers earlier, or maybe see cancers that are invisible on the regular 2D mammogram, it also has the bonus of having fewer false positive results. So some of you may have had this happen where we do your mammogram, your screening mammogram is called abnormal, and we recall you to come back to do some additional imaging. That's actually pretty common. About 1 in 10 mammograms that we do for screening, we have to have the woman come back to do some additional workup to kind of see what's going on because things might change or look different. Most of those cases end up being fine, but some of those cases of abnormal mammograms will end up being breast cancer. So it's really important that we do these workups. But when we have the ability with a 3D mammogram to look through the breast, we have fewer false positives because we're just able to see things more clearly. Now, when this technology first came out, and Hoag was actually the first in California to have 3D tomosynthesis and offer this clinically, it was a pretty limited resource. So I think a lot of information went out there saying only women with dense breasts should get 3D mammograms. But the truth is 3D mammograms are better for women with all different types of breast densities. Even if you have not dense breasts or what we consider fatty breasts, the 3D mammogram is still helpful and can be beneficial for us to find cancer earlier and to reduce those false positives. This is a picture of a 3D mammogram. You may or may not be able to tell, but in the center of that red circle, there's almost like a radiating set of lines. It looks kind of like a spider web that's radiating out from the center. And this is the same person, same woman, a regular 2D mammogram on the left-hand side and one slice from the tomosynthesis on the right-hand side. And actually, we were able to see the cancer on the 3D, but we really couldn't see it on the regular 2D mammogram. Okay, this is my final myth and misconception, and this perhaps is one of the most important ones for people to understand. Only a small fraction of women age 40 and older in the U.S. do not get yearly or biennial mammograms. So there's so much, right, especially during October, and we're talking about breast cancer awareness, and everybody knows what a mammogram is, and everybody knows that over a certain age, 40, some people say 45, some people say 50, that's a whole nother talk to talk about the controversies of how often or when you should start doing your screening mammogram. But people think that everybody gets their mammogram. But the truth is, really only about 50% of women get their mammogram every year, and about 66% of women get their mammogram within every 2 years. And it's important for people to know because mammograms can save your life. So, don't forget to get your mammogram. Breast cancer doesn't make exceptions for anybody, and we know that getting your mammogram and detecting breast cancer early is one of the best things we can do to help prevent women from dying from breast cancer. So unfortunately, you can't do a mammogram online, and hopefully someday we'll come up with a blood test or, the thing that everybody is hoping we can to avoid doing mammograms. But for right now, mammograms really are our gold standard for screening asymptomatic women for breast cancer. So please go out and get your mammogram. If you're of screening age and you still have breasts, you should get your mammogram regularly because we want to do the best we can for you and try and prevent women from dying from breast cancer. All right, so those are my slides. And now at this point, I'm going to turn it over to my partner, Leanne. And Leanne's going to talk about healthy eating and for body and mind, and specifically how it relates to breast cancer survivors and staying healthy. Okay, Leanne.
Thank you so much, Dr. Lopez. Again, my name is Leanne Martirosian, and I've had the pleasure of being a clinical dietitian at Hoag Hospital for the past 20 years. I've worked in a variety of different capacities at Hoag, including cardiac rehab, critical care, but I've always had my fingers in oncology care. That's truly my passion, so it's an absolute pleasure for me to be here today. Thank you very much. Today I'd like to talk with you about good nutrition to help you to support you through your cancer journey, achieving healthy weight goals, and some current topics of interest. Although there are many nutrients that demonstrate anti-cancer properties, there is no single food or nutrient that can prevent cancer or its recurrence. It's truly the synergy of compounds in the whole foods that we eat that offers the strongest protection. Prolonged inflammation is really the crux of the problem. It can damage your body's healthy cells and weaken your immune system, which increases your risk of cancer and other diseases such as diabetes, heart disease, and Alzheimer's. Current evidence shows that chronic inflammation is associated with reduced survival in women with breast cancer. A major source of inflammation trigger foods comes from processed foods, which are low in nutritional value, high in sugar and fat, and loaded with artificial ingredients that can increase C-reactive protein and interleukin levels, which are pro-inflammatory blood markers that are correlated with tumor growth and metastases. So how do we stop inflammation through good nutrition? I want you to eat the rainbow of fruits and vegetables. I want you to flood your body with phytochemicals, those substances that stimulate the immune system, protect cells from carcinogens in our diet and environment, and reduce inflammation. Phytochemicals can prevent DNA damage, help promote DNA repair, and help regulate hormone levels. Phytochemicals can slow the rate at which cancer grows. Scientists have not identified all of the protective substances in fruits and vegetables, so there is no evidence to support a pill form of any single phytochemical. We know that phytochemicals in food work together to provide cancer protection, and that our bodies prefer nutrients in food, not pills. Anti-inflammatory eating also includes the healthy omega-3 fatty acids, such as fish, flax and chia seeds, nuts including almonds and walnuts, avocado, and olive oil. Every day, I want you to eat lots and lots of fruits and vegetables. Fresh, frozen, cooked, raw, I don't care. Just lots and lots of fruits and vegetables. I want you to choose the high fiber complex carbohydrates, the legumes including split peas, lentils, black beans, garbanzo beans, etc., fresh herbs and spices, and the healthy monounsaturated fats including nuts. I want you to choose poultry, eggs, fish, and dairy in moderation, and I want you to limit red meat and sweets to more of a special occasion. I strongly encourage you to avoid processed meat, things like bacon, sausage, pepperoni, as we know that they have direct carcinogens. This Mediterranean-style eating pattern is high in fiber, those essential omega-3 fatty acids, and the immune-building carotenoids. This diet plays an important role in modulating inflammation. The carotenoids in dark green leafy vegetables can inhibit growth of breast cancer cells. So I want you to remember this picture. There is evidence to support eating 1 to 2 cups of green vegetables every day is a powerful weapon in inhibiting breast cancer cell growth. So choose salads, green smoothies, soups, do whatever you can to get your greens in. So on this slide, I am asking you to veg out, not freak out, okay? The major organizations, including the World Health Organization, the American Cancer Society, all recommend a goal of 7 or more servings of fruits and vegetables every day for secondary cancer prevention. This is not the advertised recommended goal of 5 servings a day, which is targeted at the average American. I'm giving you the facts because you're not average Americans, so I want you to know what the evidence truly shows. There is strong evidence that eating a diet high in fruits and vegetables is recommended for primary cancer prevention. But there is also good evidence to support that eating a diet rich in fruits and vegetables is essential in improving outcomes in those treating metastatic disease and in preventing recurrence of breast cancer. The strongest evidence has been found for green and yellow cruciferous vegetables and dark leafy greens. Citrus fruits and fruits high in vitamin C also show strong protective properties. So steamed broccoli is a good old standby, but my boyfriend makes the most fantastic grilled Brussels sprouts that I could eat 3 or 4 days in a row. I made a big pot of vegetable soup last week with an entire head of cabbage. And my teenage son is now accustomed to eating entree dinners that have a base of spinach or kale or mixed greens. I always have a bag of frozen berries in my freezer to add to my oatmeal, to my yogurt. I always have some kind of citrus like oranges or tangerines. And I love to start the day with a glass of water mixed with some yummy fresh Meyer lemon juice. Finding a healthy weight is an important part of survivorship. Excess body fat is strongly linked to increased risk of recurrence and metastases. The Women's Healthy Eating and Living study showed that most women undergoing chemotherapy had unwanted weight gain and suggested that weight loss is required to achieve improvements in breast cancer outcomes. Breast cancer treatments can slow down the metabolism, cause hormonal changes, and negatively impact your ability to stay active. Fat cells produce estrogen as well as proteins that cause high insulin levels. We know that high insulin levels can promote cancer cell growth. Fat cells produce inflammatory cytokines, which can lead to chronic inflammation, which we know is linked to increased cancer risk. When it comes to losing weight, start by setting small, achievable goals. Start with 5 to 10% of your current weight. So let's say you're starting at 200 pounds. I would recommend a goal of losing 10 to 20 pounds in the next 6 to 12 months. We know that the more time you take to lose weight, the much more likely you are to keep it off. Involve your family and friends. Ask your partner to help with buying more fruits and vegetables and not buying those big bags of chips at Costco. Plan a dancing Zoom happy hour with your friends instead of the wine and cheese happy hour. Make sure to involve your entire circle of family and friends. So yes, I'm a dietitian. It's my job to talk about food, but I'm also a firm believer in the benefits of exercise. Exercise helps to slow down or combat the hypometabolism or the slowdown in metabolism that typically occurs with breast cancer, and it helps to strengthen our immune system. Exercise decreases stress hormones such as cortisol and helps us to manage symptoms of depression and anxiety, which for me is even more important during these challenging times. Regular activity makes us feel stronger and more confident. I want you to include activity that raises your heart rate and includes strength training to help preserve and build muscle mass. Make sure to schedule yourself in and make exercise a part of your daily self-care routine. It doesn't matter what kind of shape you're in. Start wherever you are and increase the time and intensity of your activity slowly and within your individual physical capabilities. Choose a variety of activities that will keep you interested and motivated. Most of us will never run a marathon, but walking the dog, Zoom yoga, walking on the treadmill, or even Frisbee with the kids, it all leads to success. Create a lifestyle filled with movement that makes you happy. So the weight loss equation is really no secret. Less energy in, more energy out. But how do we do that? Portion control is the key to reducing calorie intake. Stop drinking beverages with calories and limit added fats and the high-fat, high-sugar snack foods. Eat mostly plant-based with the goal of at least 2 cups of fruit and 3 cups of vegetables every day. On average, a serving size is about the size of your fist or a baseball. However, if you're going through treatment and are actively experiencing side effects that leave you unable to eat well, such as nausea or vomiting, then all bets are off. Eat and drink whatever you can to maintain yourself. Short-term intake will not have long-term consequences. So the one thing in common among people who have successfully lost weight and kept it off is accountability. Using an app such as MyFitnessPal can be a great tool to help you increase your awareness of how much and why you're eating. Also, finding online support through a formal program such as Weight Watchers can be a helpful tool. A smaller but significant number of patients going through treatment have lost too much weight or have become underweight. So if this is the case for you, make sure to eat 3 meals and 2 to 3 snacks every day. Another guideline is to eat or drink something with calories every 2 hours. Choose easy to digest liquids to provide nutrition, such as smoothies, soups, fresh juices, milk or milk substitutes. You can make protein shakes with fruit, protein powder, yogurt, nut butters, and whole milk or almond milk. Choose high-calorie, high-protein snacks and cook with extra olive oil. The plate method is a simple visual guide as to what our meals should consist of. So half of our plate should include fruits and vegetables, a quarter of our plate lean proteins like chicken, fish, or beans, and a quarter of our plate a good, complex, high-fiber carbohydrates such as oats, whole grain breads and cereals, or sweet potatoes. So while this slide shows an excellent visual representation of how I recommend you eat, the 9-inch plate is likely too large for most breast cancer patients. You may need to choose a 7-inch or even a 5-inch plate instead. Eating plant-based is colorful, and personally I think it's absolutely delicious. I always have a good stock of garden burgers in my freezer so that I can make a quick sandwich or add a flavorful plant-based protein to my salad. There are a lot of reasons why we eat other than being hungry. Start by keeping temptation foods that are low in nutritional value out of the house. Make sure to not skip meals and always start with a small portion of food. Pay attention to why you are eating. Are you tired? Are you bored? Are you stressed? Ask yourself, am I really hungry? If the answer is yes, and you really are that hungry, then you can go eat that apple instead of those chips or cookies. Slow down and enjoy your food, knowing that your good choices will help you move towards your individual health goals. So to get back in touch with your natural appetite trigger, remember to stop eating when you are no longer hungry, which occurs far sooner than when you feel full. This is subtle, and it takes time to reconnect your body and mind to this sensation. Just don't be like my favorite Uncle Walter, who would push himself away from the table and say, "Time to unbutton my pants. I guess that means we're full and we're done eating." Eating according to a bunch of rules is not fun or healthy and only gives us the illusion of control. A lot of money is spent on complicated, overly strict fad diets, which tend to induce a lot of stress and guilt when we can't follow them. Find an eating pattern that promotes health and enables you to stick to it for life. So our immune system is based in our gut, and it's often disrupted due to cancer treatments and antibiotics. So I do recommend taking a refrigerated probiotic with at least 10 million organisms per dose. However, don't take a probiotic if you're neutropenic or immunocompromised, which can happen when your blood counts fall after certain types of chemotherapy. You can always safely eat things like yogurt or other fermented foods to get those healthy and naturally occurring probiotic bacteria. If you're not sure, ask your oncologist. Okay, so a few myths or facts. Eating moderate amounts of soy is safe for women with breast cancer and does not increase a survivor's risk of recurrence. Some small studies suggest soy may be protective for women who take tamoxifen, but more research is needed. Choose whole soy, such as soy milk, tofu, or soybeans, rather than concentrated powders or supplements. So the keto diet continues to be a popular diet trend. There was a small study published earlier this year that demonstrated decreased insulin levels and inflammatory markers using the keto diet, but the sample size using metastatic breast cancer patients was far too small to make this a standard treatment option. And I would consider it potentially harmful given the extremely high fat content, especially the saturated fats. While there is no strong evidence that eating organic foods lowers cancer risk, I personally believe that reducing our exposure to chemicals and pollutants is a healthy choice, especially to preserve liver function. So this is an interesting tidbit. Coffee may actually play a protective role in keeping breast cancer from metastasizing to the brain. But I'm talking coffee, not the grande caramel macchiato. Okay, so this is a big one. Does sugar feed cancer? As an oncology dietitian, I get this question all the time. So let me see if I can break it down for you. First off, there is no direct link between sugar and cancer risk. But high sugar intake increases insulin levels. Cancer cells have plenty of insulin receptors, making them respond more than normal cells to insulin's ability to promote growth. High sugar intake, especially the simple sugars, also will result in excess calorie intake, unwanted weight gain, and increased body fat, which we know can increase postmenopausal breast cancer risk. Sugar, or glucose, is the fuel that feeds every cell in our body, including our brain. So even if you cut out all carbs from your diet, your body is going to make glucose out of your muscle mass and immune system cells, leaving you very compromised. So fear or sugar of carbs often results in overly restrictive diets, causing anxiety, eventually poor outcomes, and even malnutrition, which is unfortunately something I've seen far too often in the hospital. Choose less added simple sugars and focus on the good high fiber complex carbohydrates. You can eat your carbs with a little bit of protein and fat, such as a piece of fruit along with some nuts to help moderate insulin levels. And also eating small, frequent meals will help balance out and keep our insulin levels at a more normal standard. Okay, so what do I do? Well, I try to follow the 90-10 rule. 90% of the time, I eat 5 things. That's my foundation. I eat vegetables, lots and lots of vegetables. I eat fruit, a lot of fruit. Okay? I eat my good high fiber complex carbohydrates. I eat my lean proteins, including some plant-based choices, and then I eat my healthy fats. I probably eat half an avocado 6 days a week. Okay? So yes, I'm a dietitian, I love food, I live to eat, but I don't eat food that I don't like. So I make a big effort to find good, healthy food that I love and include it every day. I try to eat more whole food, less processed food. I'm a huge fan of batch cooking. So as I mentioned, I made a big pot of vegetable soup last week, put them in individual containers, put them in the freezer, so when I'm in a time crunch, I can just open the door and have my healthy fast food rather than having to rely on something that's not such a good choice. It's important to drink plenty of water. That's a big problem for me, so I really try to do that. I think that's very important. Making sure to get a good amount of restorative sleep every day, I think, is also very important. I'm a firm believer in moving your body in a healthy way every day. Even if it's just a 10-minute walk or 10 minutes of stretching, I think it's all very, very important. So finally, I just want to throw out one reminder. Change and developing new habits, it takes time and it requires patience. Remember to take pride in your body and respect what it can do. In my experience, working with patients that have breast cancer, you're warriors. I am in awe. I am inspired every day to be the best that I can be. And I have to remind myself, while my body may not be perfect, it's perfect for me. Thank you very much for having me here. It's been wonderful, and I look forward to seeing all of you next year, hopefully live and in person.
Thank you, Leanne. That was wonderful. I love that talk, and I have to say, in the setting of this COVID pandemic, that was extra information, relevant. And I know there are probably people other than me fighting the COVID-19, meaning the 19 pounds that we all gained during COVID. So that was wonderful. And I really like the part about that tip about the portion size and the size of your fist. Mm-hmm. That's a really nice thing to remember. I'll remember that. And I'm now very sad that my fist is very small. I wish I had a bigger hand. We do have a few questions that that came up during the talk, and we'll try and address some of these questions. Okay. And one of our watchers was wondering if you can repeat again the 90-10 rule, if you can talk about
Absolutely, that. Absolutely. So I'm a firm believer in having a solid foundation. So 90% of the time, we eat 5 things, okay? Vegetables, lots and lots of vegetables. Remember, fresh or frozen, cooked or raw, I don't care, eat a variety. Make sure that you're planning ahead and you're getting them in every day. Fruits, again, fresh or frozen, make sure you have lots on hand. I'm not a fan of dried fruits or juices on a regular basis. I definitely prefer the whole fruit that has the fiber in it. The good complex carbohydrates, so high fiber whole grain oats, whole grain wheat, cereals, breads, things like sweet potatoes, brown rice, quinoa, those are all the good carbs that we need. Our lean proteins, so more chicken and fish and turkey, also some good plant-based options including soy, and then those healthy monounsaturated fats, so nuts, seeds, nut butters, avocado, and olive oil. And then the 10%, which thank you, that's something I forgot to talk about. That's the fun part. So the 10%, those are the fun foods. If you have that solid foundation, then you can feel very confident to have 1 or 2 meals a week that are not in line with these recommendations. So I can have a piece of pizza with my son and relax and feel good about it. And I'm not gonna lie, this Saturday's Halloween, I'm probably gonna be eating Reese's Peanut Butter Cup for dinner. And I'm gonna love it. So nobody eats a perfect diet, I don't. But I think as long as we take a look at our habits and we are making choices that are moving towards improvement, that's success to me.
Excellent. Okay. I'm going to address a question that was asked by one of our watchers about their experience during diagnosis where there was a tumor that was found on a mammogram and an ultrasound. But when this person went to mastectomy, there were 2 additional tumors that were found that apparently weren't detected by the MRI that was done prior to surgery. And the question is, does that happen often? And the answer is, it doesn't happen very often, but it's not entirely surprising because, again, none of the tests that we do prior to surgery and treatment of breast cancer are perfect. None of these things are going to be able to be black and white and see, with complete accuracy where cancer is present and where it's not present. Unfortunately, those type of tests don't exist at this time, as with most things in medicine. It's our best guess. But when we do mammograms, ultrasound, and MRI together, most of the time I would say we have pretty good accuracy. And the only way we know for sure is once surgery happens and our pathologists look under the microscope and see really where the tumor cells are. So if you kind of think about imaging, we're looking from far away. We can't look under the microscope and see to that level of cells. So if there are a few cells here and a few cells there, we're not going to be able to see that on imaging. But as far as the accuracy goes, in most women and men who are treated, the imaging is pretty accurate. But occasionally we will have cases like this where there are things under the microscope that pathologists see that we just can't see on imaging. So hopefully that answers that question. A couple other questions. There was a question about the brat diet. And somebody sounds like is under kind of abiding by the brat diet at this time and was wondering when it would be appropriate to transition to a healthy diet. Okay. Can you comment on that?
Sure. So the brat diet has been around for decades. Bananas, rice, applesauce, and toast. That's what my grandmother said she used to do when the little kids had diarrhea. So essentially what it is, it's a low fiber diet for those patients who are suffering from diarrhea, either caused by chemotherapy, or it could be from radiation if they've had some prior pelvic radiation. So the low fiber diet is meant to eliminate that indigestible part of food that can be irritating to the colon. We're assuming that the colon is inflamed and it's just not absorbing. So you want to keep up the fluids. That's number one. If you're having diarrhea, keep up your fluids. Eat those easy to digest, bland, low fiber foods until the diarrhea starts to subside. Certainly if the diarrhea is getting out of control and this type of diet isn't working, that's when you need to talk to your doctor and perhaps look at some kind of anti-diarrheal medications. But if the frequency and the consistency is starting to improve, you're having less bowel movements, less episodes of diarrhea, it's starting to firm up a little bit. Sorry, I'm a dietitian, I talk about poop,
It's
no
okay,
problem.
I'm a doctor. So.
So, if we're going from, let's say, 5 a day down to 2 a day, then I would start adding back in some more of those good, healthy, high-fiber foods. So you want to start with things that are still going to be a little bit easier to digest, so things like melons, seedless watermelon, cantaloupe, things like that. Start with some more cooked vegetables, and if you do well with that, then you can start adding back things in that have more skins and seeds, so like apples and strawberries, maybe starting to get some salads in. Start with the small portion and see how your body responds. So you're having a little bit of salad, then wait 3 or 4 hours and you'll see, okay, am I doing okay? I didn't have any diarrhea. Okay, now I can start adding back maybe in some more things. So generally start with 1 new food a day, see how you tolerate it, and then progress from there.
And I think you kind of addressed this in your talk, but maybe one of our viewers is asking about whether there are specific fruits or vegetables to help with inflammatory issues in particular, because I think you talked about a lot of different fruits and vegetables, and there's a pretty long list. But if there are just a few that people need to focus on or are really interested in terms of inflammation, are there particular fruits and vegetables that you would recommend?
Absolutely. So I think the number one thing, if you remember anything, is the dark green vegetables. Okay, so that would include the leafy greens like spinach and kale, mixed greens. I love the 50-50 blend. I get the giant carton at the store. Can make about 3 salads from. The green vegetables, also things like broccoli, Brussels sprouts, cabbage. I think those are going to be the most important things that are going to help fight inflammation and get those phytochemicals, those anti-cancer properties. Those substances, those are going to be the most important ones. And then if we're looking at fruits, definitely the citrus fruits, so your oranges, tangerines, grapefruits, and then the fruits that are high in vitamin C. So making sure you get the berries, which are also loaded with those antioxidants, so strawberries, blueberries, raspberries, and then the melons, so watermelon, cantaloupe, honeydew, that are high in vitamin C. I think those would be my top anti-inflammatory fruits and vegetables. Again, I'm about eating what you like. So find foods that you like, experiment, try different things, and eat a variety. But if you were going to do anything, it would be like an orange and some broccoli.
Well, it's colorful, so that's good too. There was one question that came across talking about or asking about the night shift worker and why we think that night shift can cause cancer. And I'll give you the honest truth is I really don't know why. I just thought it was interesting, that they did a study on that and found that. But I would maybe this is the Dr. Lopez hypothesis. I don't know. And I think it's interesting because sometimes I work the night shift too, but perhaps it has to do with cortisol levels, staying up at night, and when your sleep balance is off, it really does affect a lot of your homeostasis and hormones and all kinds of things. And I do know that cortisol levels can be altered when you're up all night and sleeping during the day. And sometimes those, we know cortisol can affect all different things in your body, your metabolism, levels of everything. So perhaps that's the cause, but that's just my guess, and I really don't know the answer, so I'll be honest with you on that. I don't know if Leanne has any other thoughts on that.
I agree with Dr. Lopez 100%. I have had the opportunity to work quite a lot with patients who are suffering from obesity and heart disease, and that's the exact cause. I can't tell you how many night shift nurses I have seen for weight loss counseling. They don't get enough sleep. Those stress hormones, that cortisol, that adrenaline, it's just through the roof. And then working in cardiac rehab, we know that this chronic sleep deprivation is an independent risk factor in developing heart disease. It's not one of the major ones, but it's another factor. So I will see emergency room doctors who can run marathons, and they end up with a heart attack in their 40s because their stress levels are just so high, they're not getting enough sleep. So night shift is tough.
Yeah, I agree. don't put your mask on yet. There's another question for you about someone wanted you to see if you can expand a bit on the discussion around tamoxifen and soy.
Okay.
And, I imagine there will be maybe several of you having this question as, many of you may have hormonal therapy incorporated into your regimen. And I'm Asian, so I love soy, and I'm sure that, a lot of you guys do too, so.
So the studies that I've looked at addressing soy and those patients who are taking tamoxifen have tended to be small sample sizes, so it's difficult to draw a conclusive recommendation. So I always go back to, if you're not sure, if you have concerns, if you're stressed out by it, then you want to talk to your oncologist and certainly get the oncologist's expert opinion. But I do think it's safe to eat moderate amounts of soy when it comes from whole foods. So like I mentioned, soy milk, soybeans, edamame, tofu, I think those are perfectly safe because the dosage of those isoflavones, those weak estrogens, are very low. What you definitely want to avoid are things like soy powders or supplements. Those I would definitely recommend avoiding.
All right. And there's one more question here for us at this time, which is about fat necrosis and whether there are foods that may be healthier that can avoid fat necrosis. And I don't know that there is an answer to this question, but I'm going to send it to you. Before you kind of talk about that, I'll just, for those of you who may, I think many of you may be familiar with this phenomena of fat necrosis. But what fat necrosis is something that happens many times after surgery that actually can happen after any kind of trauma to fatty tissue, so which we all unfortunately have in the breast to different degrees. So when things like surgery happen or other types of trauma, and basically the normal fat cells in our breast die or are traumatized, they kind of form liquid fat. And the body does not like liquid fat. It thinks it's something foreign. It creates an inflammatory response and can end up forming these kind of balls or masses of fat in the breast that can become very firm, can look and feel like a hard lump in the breast, occasionally can be painful or cause discomfort. And that's something that oftentimes is, most women who have had surgery or men who have had surgery will develop some different level or degree of fat necrosis in the postoperative period, and that can go on for years. You can develop more and more fat necrosis many years even after surgery and treatment has happened. So.
Okay. So I am not aware of any specific food or nutrient that would help combat this phenomenon. I think I would just give my general recommendations of, again, making sure we're getting lots of antioxidants, a lot of phytochemicals, keeping our blood as clean as possible, and drinking a lot of water.
Yep, lots of water. That's good for you for many different reasons, so would definitely encourage that. We have a couple more questions. They're rolling in now.
Excellent.
So that's good. You guys
Wonderful.
are getting into it. We love it. Is there a link between consuming red meat and the occurrence of breast cancer? And I know, a couple years ago, those new guidelines came out with, reclassifying red meats as, a carcinogen. So can you talk about that, Deanne?
A little bit more. So yes, a few years ago when the World Health Organization came out with their guidelines identifying red meats, especially the processed red meats, as being a direct carcinogen, it was the evidence was pretty strong when it was linked to colon cancer and the different GI cancers. So that's an easy statement for me to make. The research that I've seen hasn't shown a direct link between red meat consumption and breast cancer. But that's a leap I'm willing to make in terms of recommendations, because honestly, as wonderful as a good steak is, we don't need it to live. Although I know quite a few men who might disagree with me. I know bacon is man candy, but keeping it to a minimum, and certainly choosing good quality red meats when you choose to eat it, grass-fed beef, the leanest possible. If you're grilling it out on the barbecue, making sure you're eating it with a good vitamin C source so that we can counteract that those nitrates and those oxidizing substances that come along with red meat.
Antioxidants. Okay. And then let's adjust, maybe we can do one more question?
Sure.
Okay. What can you do to increase your white blood cell count? And I assume this is, this applies to you.
Well, you know, it's
Since neither of us is a medical oncologist or a hematologist, we're gonna not broach the topic of medication because there are medications that can be modifying your white blood cell count. But perhaps in terms of just your immune system, you know, I think Leanne's talked about that quite a bit already.
Right.
But you know, that.
So having breast cancer in and of itself isn't going to decrease your white blood cell count. It's the chemotherapy, so it's a side effect of the chemotherapy. And there's nothing that nutrition can do about that. I mean, certainly eating well is going to make you feel as good as possible because when your white cells and your red cells are down and you're neutropenic, you're weak, you're tired, there's just no way around it. So staying hydrated, getting enough rest, eating a good balanced diet is going to help you feel as good as possible, but no food is going to make those white blood cells come back up. It's going to be a matter of talking to the oncologist, and well, the oncologist will tell you this is what you need to take to get your white blood cells up if they get to a critically low level.
All right. Well, thank you so much for joining us. This is going to conclude our event tonight. We have many more events planned for the future, so just keep your ears out for those as part of our Hoag Healing Breast Cancer Empowerment Series. And thank you for joining us.
Thank you so much. Thank you, Dr. Lopez.